Take your HVE, twist it off from the existing tubing, and attach the Dry Shield DS1 onto it. Place it back on the toolbar. You have now converted your room into a Dry Shield room. Select your mouthpiece. Select the correct mouthpiece size to ensure a proper seal and for your patient's comfort. Prior to insertion, spray a mixture of air and water on the outer surface of the mouthpiece for moisture. Also, spray the inner lining of the mouthpiece for additional lubrication. Slide the mouthpiece onto the DS1 by rocking it back and forth until it locks into place. Dry Shield is the newest innovation in dental technology that creates a better overall patient experience and reduces your procedure time. The soft, smooth, and flexible mouthpiece is specifically designed for patient safety and comfort. Dry Shield helps keep the working area dry and visible by continuous, uninterrupted suctioning while keeping your tongue and cheek out of the way. Dry Shield also acts as a safety barrier, protecting your airway from potential particles and debris. With Dry Shield, you will not have to strain to keep your mouth open. You can now simply rest your teeth comfortably on the bite block. The key to Dry Shield is to always breathe through your nose. This will ensure comfort and relaxation throughout the appointment. First, turn the lever on. Before inserting the mouthpiece, fold the tail towards the center of the mouthpiece. Next, fold the sides together. Ask the patient to open their mouth while reminding them to focus on breathing through their nose to promote relaxation. Slowly insert the mouthpiece lining up the front edge of the bite block with the distal of the canine. Then, let go of the mouthpiece, letting it adapt to the oral cavity. Use finger pressure to adapt the cheek retractor along the inner surface of the cheek. Adapt the top of the mouthpiece to the palate and the bottom of the mouthpiece to the floor of the mouth. The narrow portion of the mouthpiece should be distal to the most posterior molar. Reposition the upper and lower lips around the corners of the bite block. You are now ready to do Dry Shield dentistry. Again, don't forget to remind the patient to breathe through the nose during use of the Dry Shield. When treatment is completed, have the patient open wide and gently remove the mouthpiece. To remove the mouthpiece when the procedure is over, simply rock the mouthpiece back and forth until it detaches from the DS1. Detach the bite block from the mouthpiece and place them in the ultrasonic for a minimum of 15 minutes. Once the mouthpiece and bite block have been thoroughly cleaned and rinsed, you are now ready to sterilize them. Place the bite block and mouthpiece into an autoclave pouch and mark the pouch with the size and number of times used. You can now put it through the steam autoclave along with the rest of your dental tools. Selecting the correct mouthpiece size will lead to a proper fit and seal, ultimately leading to an ideal isolation, retraction, and suction. The key to success with Dry Shield is sizing the correct mouthpiece for your patient to ensure the best seal. Here, you can see a poor seal. There is a gap between the mouthpiece and the palate. This poor seal could lead to poor suctioning and pooling. In this case, the mouthpiece is too small. To correct this, go up at least one size and reevaluate. For this area, there is a gap between the mouthpiece and the floor of the mouth. Again, this poor seal may cause poor suctioning and pooling. The mouthpiece is too small. Go up at least one size and reevaluate. Here, the mouthpiece is too large. You can also see the bite block is also too large and is sticking outside of the mouth. A seal is not formed, and a smaller mouthpiece is needed. A good indication that your patient is a mouth breather is an active tongue pushing on the Dry Shield mouthpiece. An active tongue can affect optimum suctioning of the oral cavity and patient comfort. Simply reminding your patient to focus on breathing through their nose will relax the tongue and correct this. Remind the patient to rest their teeth on the bite block versus biting down hard on it. Biting too hard on the bite block may cause patient discomfort and displacement of the bite block, as well as decreasing the patient's vertical opening and your visibility. To attach the bite block to the mouthpiece, Squeeze the mouthpiece while simultaneously pulling the strap on the bite block over the mouthpiece. Slide the strap into the notched area on the mouthpiece and slide the bite block onto the mouthpiece. With an index finger, press the plug into the bite block undercut slot. Ensure a snug fit and that the bite block is locked into place with the strap lying flush with the mouthpiece. To detach the bite block from the mouthpiece, pull the bite block off of the mouthpiece, detach it from the plug, and gently slide the bite block strap off of the mouthpiece. To split a high suction line, simply detach the high suction tubing from the canister port and replace it with the Dry Shield Y connector kit. You are now ready to dedicate one end to the dry shield and the other end to a second high suction line. Don't forget to give your patient encouragement and to remind them to breathe through their nose. Unlike the standard rubber bite block, the Dry Shield bite block is attached to a mouthpiece. As you slide the bite block posteriorly, the mouthpiece will simultaneously slide towards the back of the oral cavity. Keeping the patient's gag reflex in mind, carefully slide the Dry Shield bite block further back as needed.